Hi students, today I am going to discuss about antidote administration in poisonous patients. First, the antidote means it is a chemical substance that stops or controls the effects of poisoning in poisonous patient. The proper antidotal administration can be a life-saving in the poisonous patients. Antidotes may work in number of ways. The antidotes have different type of mechanism action. The first one is inert complex formation, accelerated detoxification, decreased toxic conversion, receptor site competition, receptor site blockage, and toxic effect bypass. This antidote have 6 different types of mechanism of actions. Okay, the first one is inert complex formation. Here inert means inactive. Here when we administer the antidote, it will go and bind to the poison and it forms a inactive formation. Otherwise it forms a inactive complex. This inactive complex does not work in the body directly, it excreted from the body. This inert formation, it won't shows any poisonous effects in our body. It directly eliminates through urine from the body. The example of this inert complex formation are dicobalt aditate for cyanide poisoning, Prussian blue for thallium poisoning, chelating agents for heavy metal poisonings. Okay, the next one is accelerated detoxification. This means here some antidotes will convert toxic substance to non-toxic substance. It converts poisonous substance to non-poisonous substance. Example of this type are this thiosulfate will convert this cyanide poison to non-poison like thiocyanate. This cyanide is a poisonous substance. This thiocyanate is a non-poisonous substance. This thiosulfate will convert cyanide into thiocyanate. Okay, the second example for accelerated detoxification, here acetylcysteine will detoxify this paracetamol poisoning. Next, third one is decreased toxic conversion. Okay, in decreased toxic conversion, here the antidotes will reduce the metabolism of the poisonous compounds. Here the antidotes will reduce the metabolism of the poisonous or toxic compounds. Example like this ethanol will prevent the metabolism of the methanol and it stops the conversion of methanol toxic metabolites. Next one is receptor site competition. Here receptor site competition means here antidotes will displace or removes the toxin from the receptor sites. Here antidotes displace or removes the toxin from the proper receptor sites. Example of these types are naloxone will antagonizes the opiate effects. This opioid will go and act on proper opiate receptor like mu kappa delta. This naloxone will go and remove these opioids from this receptor site. Next one is receptor site blockage. Here in this antidotes will block the receptors that is useful for the poisoning. Antidotes will block the receptors that is useful for the poisoning. Here mainly atropine will binds to the muscarinic receptors before the anticholinesterase poisoning. If the anticholinesterase is like neostigmine, rivastigmine, pyridostigmine, if we take overdose of this anticholinesterases, before this poisonous substance only atropine will go and bind this muscarinic receptors and it will block the effects of anticholinesterases. Next one is toxic bypass. Toxic bypass means here we are eliminating the poisoning by the short way, or we will eliminating the poison through short way, or we are eliminating the poison very fastly from the body. Here example like gas poisons normally affect through the inhalational route and these directly attacks to the lungs. That's why here we are using 100% of oxygen to remove the poisonous gas from the lungs. Here 100% O2 is using for the cyanide gas poisoning. Directly we are eliminating the poison through the lungs. Okay, this is about the antidote administration in poisonous patient, and we have different type of mechanisms to treat the poisonous patients based on this antidote administration. Thank you.